congratulations to all the participants who have successfully completed this very unique course. I think it's one of the only course of its kind in the field of genetics. And I think, you have to give it, doff your hat to Stan for the passion and perseverance that he has shown in taking this very difficult subject, which was a very small part when we did our MBBS. I mean, when we did our medical training, and then bring it to people who are not necessarily all of them are medical doctors. And I think he needs a big hand, show your hand to Stan and his team. Coming to the topic, I think a lot of people have said a lot of things. So I have just to tell you one thing that, any kind of knowledge that you get is always good. You may lose money, you may lose health, but knowledge will always stay with you. It is said that Saraswati ki puja karo, Lakshmi apne aap aa jayegi. At least that's what I believe. And I also did this course, and I've been associated with genetics in this nutrigenomic diets and things like that. I learned a lot, though I don't personally practice the field, but I'm like to have knowledge about it. I'll just touch on 2 or 3 things, probably those aspects which others have not talked a lot on. The first is, which the previous speaker just touched briefly, was pharmacogenomics, and 2 other things which I feel there are fields which need more, what do you call it? There is a scope for entrepreneurship, as well as people can explore them, which is addictions and personality disorders. So pharmacogenomics is something where, based on your diet, based on your genetic studies, the dosage of certain drugs, like he mentioned clopidogrel, but then there are others also like metformin and many antihypertensive drugs, which a person would take lifelong. Now, there are people who are slow metabolizers, which means that the drug gets accumulated in the body, and therefore they will need a proper dosage. And it is anticipated, it's already coming in the West and will soon come to India, that medical doctors, we probably have to use genetic studies of patients when it becomes very common and maybe the cost comes down a little bit, to decide the dosage, and it will then be medico-legally compulsory for all doctors, especially if they're treating lifestyle diseases like diabetes, hypertension, obesity, dyslipidemia, all these things, to get a genetic study done and find out whether these people are slow metabolizers or fast metabolizers, and adjust the dose accordingly. Because all these lifestyle disease drugs tend to accumulate in the body, and therefore they can reach toxic levels and cause side effects. So if you know the DNA, you can adjust the dose. This is one aspect of genetics which probably others have not touched on a lot. The other is addictions. You see, a lot of things are done on nutrigenomics about diabetes, obesity. These are medical conditions. But what about, people getting addicted to alcohol, smoking, and drugs? Okay, that's a big problem in the youth today. And, you can, within, like how we have surgery, medicine, gynecology, orthopedics within our facility, our facility or faculty of medicine. That way, within genetics, you could probably not necessarily be only concentrating on nutrigenomics. You probably could promote yourself as a de-addiction counselor using the genetic studies to enhance your counseling for de-addiction. I think that is a good line to take, because that there are not many people outside psychiatrists and psychological counselors who are doing this work. So there's a scope there. A lot of people are doing in diet and lifestyle and exercise, but I don't think that many people are doing the psychological part. Behavioral disorders, which is called personality disorders, are common to people in the sense they are not psychological diseases, but they're personality disorders. If you go a little deeper into this and then connect it with the genetic studies, I think it will make a good career option. And the last thing, which I've actually discussed with Stan many times, is, dating apps are there. So you should now also think of using DNA analysis to find out as one more layer to find a proper partner. It could be for marriage counseling also, or it could be also for finding a date. So these are 2 things which I think people have not touched on. So I thought that, I should just widen the horizon of genetics as a useful tool to start an enterprise, whether it is psychological counseling for de-addiction, psychological counseling for personality disorders, and psychological counseling for probably dating apps. So with all this, I thank all of you for hearing me patiently, and I congratulate all of you once again. Keep reading, keep studying, become an expert. Doesn't matter whether you make money or not. Money is always there. It is important, but knowledge is prime. I think you must keep at it. And very, very difficult subject for all of you. And I think all of you have done very well in completing this course and becoming a certified genetic counselor. So with all this, thanks a lot. Bye from Belgaum.